9.7 Health issues related to the digestive system and eating habits. Okay, so one of the health issues is obesity. Okay, we know obesity is on rise throughout the world. And actually, obesity can be controlled, okay, if we are disciplined and we are having a strict diet management and also a routine exercise programs. But at times, it might require medical treatment, and some of the specialist doctors have suggested these surgical procedures to reduce body weight, and it is called gastric bypass. So by the name itself, a portion of the stomach and also the duodenum have been bypassed. So it seems like the stomach have become smaller, has become smaller, and that you will feel full even with less food. So the food that you eat, they are now bypassing this stomach region, some of the stomach region, and also the small intestine. Okay, so this picture is from your textbook. So you can see over here part of the stomach and also part of the duodenum that has been bypassed. Okay, so this sort like reducing the size of the stomach, and these are among the effects, the side effects of gastric bypass. Okay, so another one is health issues related to defecation. Okay, usually when you say health issues related to it, you will think of constipation. Okay, so when you think of constipation, so you will automatically link this to the in diet which has got this high content of fiber. Okay, so that is why it is very important that you're having enough fruits and vegetables in your diet, because this high fiber food is able to produce a bulk that will push those undigested food throughout the large intestine or the colon. Okay, and it's so to say it can smoothen the bowel movement, right? And not only constipation can be prevented, colon cancer, rectum cancer, even hemorrhoids also can be prevented. So you can see these are among the functions of the fiber. It stimulates peristalsis, as what I've mentioned just now, that it is able to smoothen the bowel movement. Okay, also to absorb and expel toxic substances. Okay, another one is to regulate the absorption of glucose. And it is said that if you're having diet which is high in fiber, it is able to reduce the absorption of this glucose, or not to reduce, but to slow it down. So you won't have this high spike of rise in glucose blood level right after your meal. So this is especially important for those patients having diabetes mellitus, okay, ataupun kencing manis. Also, fiber can increase the population of beneficial bacteria in the large intestine. Alright, besides diet that is high in fiber, it is very important that you take enough amount of water. Okay, so water is another food class that is very important, and it can ensure that the feces stays soft. Okay, if the feces is hard, so what will happen? Constipation is one of the problem. But when the feces stays soft, it will move along the digestive tract, the large intestine or the colon, and hence it will help the process of defecation. Okay, now let's look at the health issues relating to eating habit. Okay, eating habit. So in your syllabus, you're going to look at these 4 health problems: gastritis, muscle dysmorphia, anorexia nervosa, and also bulimia nervosa. Okay, so I'm sure you are familiar with some of the terms over here. So let's look at the first one, which is gastritis. Actually, you are used to the term gastric. Okay, every time you're having discomfort, maybe you're not having meal, you skip breakfast or you skip your lunch, you say you have gastric. Okay, actually gastric is not a correct term. Instead, you should say gastritis. Okay, whenever you see this IS over here, it refers to inflammation. Okay, what has which part has been inflamed or corrosion happens to which part? It is actually the stomach epithelial layer. Okay, inflamed by what? By gastric juice. Why is this gastric juice able to inflame this epithelial layer? Because still remember the content of gastric juice, one of it is hydrochloric acid, isn't it? So when there is no food in the stomach, what happens is that this acid, okay, which is in the stomach, may corrode the epithelial layer. Okay, because gastric acid is actually regulated in the feedback system. Okay, to increase production when needed. Okay, such as after meal. So usually there is a regular time. Okay, breakfast, lunch hour, and also dinner. So there's a regular time. But when your stomach is left empty because you're skipping one of the meal, so gastric acid, when it is being produced, but since you're skipping one of the meal, what happens is that there is no food in the stomach in that condition, so it will start to corrode the epithelial layer of the stomach. Okay, and at the time the stomach is not protected by the mucus. Now, because usually these cells, also the cells, what cells are cells in the what do you call it, epithelial cells of the stomach. Okay, remember the types. One of it is able to produce mucus, isn't it? That is a barrier to prevent the gastric acid from damaging the stomach. It's like a protector. Okay, but because of the irregular meal time, sometimes like the stomach itself is confused. By the time gastric acid is there, mucus is not there, and that is how the epithelial layer of the stomach is not protected, and it is inflamed, it is corroded. Okay, now these are the causes. It is stated here: eating irregular quantities of food at irregular hours, and it might also be caused by this excessive intake of alcohols or painkillers. Okay, another health issues related to eating habits is that this is called anorexia nervosa. Okay, have you ever heard of this? This is quite common among the teenage girls, okay, who are very obsessed with their body weight. So this teenage girl that is having anorexia nervosa, you call them anorexics. They will avoid food because they want to achieve a very ideal body weight for them. Okay, so this is a psychological problems. Yeah, okay, lack of loss of appetite. It is an emotional disorder, okay, characterized by an obsessive desire to lose weight by refusing to eat. Okay, they are too concerned on their outward appearance. They think they are fat, but actually they looks very thin. It's like the skin wrapping the bone. Can you imagine that? It's like a walking skeleton. So they eat very little, and that is how they are having this severe malnutrition. Okay, because they eat very little, they are very scared to eat. Okay, now this is anorexics versus bulimia economics. So you can see here this fellow is taking food in the fridge, but then here he is after this after having meal, after ingesting some food. Here he is in the toilet bowl vomiting out everything. So what is actually bulimics? Okay, bulimia nervosa. For people with bulimia nervosa, we call them bulimics. They are also very obsessed with controlling their body weight. They will eat a lot and vomit out the food that they have taken, okay, that they have eaten. Or maybe they will take these laxatives, which is a kind of medicine that will cause diarrhea. So they cannot resist the temptation of eating. So after eating, what they do is that they don't want the food to stay in their body. So in the long run, the patient may suffer from dehydration, nutritional problems, and even cardiovascular diseases or kidney failure. So this is also another psychological disorder, and the person actually pretends to be normal in front of the friends. Eats a lot, they cannot stop the temptation of the food. But after eating, they feel very guilty and scared that they'll put on too much weight. Therefore, they will go to toilet and put their fingers into their throat, stimulate himself to vomit out everything that they had eaten. So these bulimics, sometimes they will buy laxative, as I've mentioned just now, a type of medicine, which will cause very severe diarrhea. Okay, so hoping to remove all the nutrients from their body, they just cannot resist of eating. But after eating, they just immediately want to get rid of things that they have eaten, whether through their mouth or through their through defecation lah. Right. Okay, another one is muscle dysmorphia. So what is this health issue? This happens when some individuals they feel that their size is small, they with not enough growth. Okay, so what they do is they subject themselves to extreme training, weightlifting training, exercises. They want to build up their muscles, and they sometimes also so severe that they may consume steroids or building muscle supplements. Okay, and this is called muscle dysmorphia. Right, so we have come to the end of the chapter, and this is the summary of our chapter. We have the digestive system characterized by these processes. Okay, and also we talk about balanced diet, the energy value. There's a formula that you need to remember, and then the contents of vitamin C. Okay, this one is an experiment, diet modifications for specific individuals. Also health issues related to digestive system. Okay, effects of modifying digestive organs, the gastric bypass just now, or also these health issues related to defecation, constipation, and so on. Okay, cancer, colon cancer, and also eating habits. We have health issues, the 4 health issues related to eating habits that you need to know in your syllabus. Okay,